Good evening, doctors. Once again, welcome to the coaching program on biochemistry. Just I'll start with one slide. You might have seen this class. They're called as daffodil. There's a theory, daffodil theory. See, this is seen in one foothills of America, maybe acres of land. And then always, everybody who comes out here to see this thing have same question. So they have just put the answers on the board there. The answers says like this. From there, a theory has been coined. We call it as daffodil theory. What are the answers? First answer was simple one. Around 50,000 bulbs are there. That means that 50,000 roots and bulbs are there, plants are there. Second answer, one at a time by one woman, 2 hands, 2 feet, and very little brain. Third answer just began in 1958. So everybody asked, how many will be there? How many bulbs will be there? Who did this one? When onward they started? The daffodil theory says this much of daffodils in that area is just because one lady has been doing it every day, one at a time from 1958 onwards, meaning perseverance. So daffodil theory is about just how we can success if you are targeted and if you are move daily, if you move a little by little, whether you can have a success or not, whether you can taste the success or not. It's called as daffodil theory. It's about the perseverance. Okay, straight away to my topic, lipid metabolism and mineral metabolism. First question on, we'll start with the lipids today. Which of the following fatty acids are not synthesized in the human body? Oleic acid, linoleic acid, linolenic acid, arachidonic acid, or stearic acid, palmitic acid is there. Answer is about essential fat. The question is about essential fatty acid. The fatty acid that cannot be inside the body, but should be separate to the diet. What is that all about? They are essential fatty acid and they are linoleic acid, linolenic acid, and arachidonic acid. The option number 2, they are essential amino acid. In that we say arachidonic acid can be synthesized from linolenic acid. So we call arachidonic acid as semi-essential also. Okay. And in that, linoleic acid contains 18 carbon atoms, and at the positions of 9 and 12, it has double bonds. Linolenic acid again 18 carbon atom at the positions of 9, 12, and 15. 9. So yes, I write that. Linoleic acid. Okay, linoleic acid first. C18 double bond at the positions of 9 and 12. And linolenic acid, C18 double bond at the positions of 9, 12, and 15. So if you count from the back, from the 18th onwards, third carbon atom will be having double bond. So it's also called as, it's commonly comes under the group omega-3. But linoleic acid, 16 carbon atoms, 12, 9 and 12 positions of 9 and 12. So when we count from the back, 6 carbon atom will be having the first double bond. So it's called as omega-6 fatty acid. And we have arachidonic acid. It contains 20 amino acids. Double bond at the positions of 5, 8, 11, and 14. Okay. And then comes, what are the main functions of it? What are the functions of it? Okay, since we know that it should be supplied to the diet, it is not inside the body. They are PUFA, polyunsaturated fatty acid. names linoleic acid, and then arachidonic acid is also called a semi-essential fatty acid. Why? Why it is essential? Because our body doesn't have an enzyme who can make double bond beyond 9th carbon atom. Okay. And the question comes, what are the major PUFAs that can be synthesized from essential fatty acid? Here comes. These are about numbering. From the linoleic acid, most important two things. One, eicosapentaenoic acid. Okay, 22 carbon containing compound, which contains 5 double bonds, pentanoic acid. And then docosahexaenoic acid, DHA. So EPA and DHA are the two important major PUFAs that are synthesized from linoleic acid. That's importance. And from eicosapentaenoic acid, we can synthesize prostaglandins or eicosanoids. I'll be dealing with that word later. So just understand the name of essential fatty acid and two PUFAs that can be synthesized from this essential fatty acid in our body. Okay. Leave that. Okay. Now, going to the next topic of that, lipids in that. Lipids, when we classify lipid, we have simple lipid, compound lipid, derived lipid. And the compound lipid means which contain, when we say the word compound lipid, meaning simple lipid plus meaning simple lipid plus an extra group. What is the extra group? It can be phosphate, it can be sulfate, it can be protein. It goes like that. It can be carbohydrate. What are simple lipid? They are esters of fatty acid with alcohol. It's a simple lipid. For simple lipid, our simplest example is triglyceride. Triacylglycerol, 3 fatty acid plus glycerol. Okay, leave that. Now here, which is not a phospholipid? Your answer. Phospholipid. Sphingomyelin contains phosphate, lecithin is a phospholipid, cephalin is a phospholipid, and cerebroside. This doesn't have a phospholipid, it has a carbohydrate. Okay, cerebroside contains sphingosine. Sphingosine is the alcohol, like our glycerol. Suppose there, sphingosine plus fatty acid we call it as ceramide. To that, one sugar is attached. So cerebroside is the answer. All other contain phosphate group. Now we'll think about the phospholipids. First of all, about phospholipids is an important question. A lot of things has to be covered in that. Phospholipid, the first and foremost thing that should come to your mind is, as I said in the first class, phospholipid is a part of your membrane. We have membrane, we have phospholipid bilayer. Okay. So you should know in a phospholipid bilayer, we have one phospholipid on the outer side, one on the inner side. Which all are the major phospholipid on the outer layer? The outer leaflet, we have phosphatidylcholine and sphingomyelin. Inner, we have phosphatidylserine, phosphatidylethynolamine, and phosphatidylinositol also. I'll come to that terms. Please note. Phosphatidylcholine and sphingomyelin on the outer layer, this phospholipid bilayer, and the inner bilayer, we have phosphatidylserine and phosphatidylethynolamine. Okay. This is what about that structure, our phospholipid bilayer. In that, the outer layer contains phosphatidylcholine and sphingomyelin. And ethanolamine, phosphatidylserine, and phosphatidylinositol at the inner layer. Okay. And you should know some functions of phospholipid. What are the functions? What are the types? Phospholipid, you should know, glycerophospholipid and sphingophospholipid. In glycerophospholipid, the first is, most important, is phosphatidylcholine. Sorry. Okay, we'll start from here. Phosphatidylcholine is a major one. It's a lung surfactant. And then we have, sorry, got stuck. Just a minute. Just a minute. We got stuck. Yeah, fine. Don't worry. Minute. Okay. Phosphatidylcholine is a major component of lung surfactant. Inositol in signal transmission. That means that they act as a second messenger. Phosphatidylinositol act as a second messenger. And third, phosphatidylserine. Normally, it's present, as I said earlier, it's in the inner membrane. It's in the inner membrane. And then, important thing, it helps in the anchoring of protein. Not only that, the movement of, very important thing, movement of phosphatidylserine from the inner membrane to outer membrane, it happens during apoptosis. So that's one important fact you should remember, the movement of phosphatidylserine. Then we have another type of phospholipid, plasmalogen. It helps with the platelet aggregation and degranulation. Another one, cephalin. Another name for cephalin is phosphatidylethanolamin. Helps in the blood clotting process. Sphingomyelin, component of our myelin sheath. So these are some major functions, and you should know it's a lung phosphatidylpalmitoyl, phosphatidylcholine, or just commonly phosphatidylcholine, and it's also called as lecithin. That's a lung surfactant. If its amount is less, that leads to respiratory distress syndrome. Okay. You go to the next thing. Next question. Okay. And a newborn at 30 weeks of gestation develop respiratory distress. This is primarily due to the deficiency of, just now I said, dipalmitoyl phosphatidylcholine, or another word, lecithin is the answer for that. And which phospholipid is uniquely found in inner mitochondrial membrane and is antigenic in nature. First, it was identified in the cardiac cell, so the word cardiolipid. So that's the only one in the phospholipid that is having antigenic property. Okay. Next question about again that which one acts as second messenger, which can produce a second messenger IP3 and diacetylglycerol. I'll be coming to that word diacetylglycerol later. Okay, that is a word, as I said earlier, phosphatidylinositol symbol name, more specifically phosphatidylinositol 4,5-bisphosphate. Now, in the fetus, premature born baby may be having respiratory distress syndrome, or other word, to know about the fetal lung maturity, what we measure? We always measure lecithin sphingomyelin ratio in the amniotic fluid to know the fetal lung maturity. And it should be more than 1.2. Okay. That's all our some questions on phospholipid. One more I asked, actually already said that the presence of phosphatidylserine on the outer leaflet of the plasma membrane is a marker of, as I said earlier, apoptosis. So a few questions are there on phospholipids. So we said about essential fatty acid. Now comes the phospholipid. The third question, we just go to the oxidation of fatty acid. We know that normally our fatty acid in almost all the cell undergo oxidation and produce acetyl-CoA. That means 2 carbon atoms will be removed as acetyl-CoA sequentially, one by one. So if it is 18 carbon atom, first it removes 2 as acetyl-CoA, then 16, from 16 another 2, from 40 it goes like that. That we call it as beta oxidation. Beta oxidation. Now what happened? So that's all about beta oxidation. Then the acetyl-CoA enters into TCA cycle. We get energy by that. That's how the main energy is produced. Please understand that from fatty acid, our brain cannot produce energy. Why? Because fatty acid cannot cross the blood-brain barrier. In the blood, no, fatty acids will be always attached with albumin. Albumin fatty acid combination cannot cross the blood-brain barrier. So, because of which, brain doesn't depend on fatty acid for energy. RBC cannot because acetyl-CoA should enter TCA cycle for the energy. TCA cycle takes place in mitochondria. So, because of it, again, my point, RBC also cannot utilize fatty acid for energy. Now comes this I was telling about even chain fatty acid, 2 each going, no? So if it's a odd chain fatty acid, what will be the final product? It will be a 3-carbon, the final product along with acetyl-CoA, it will be producing a 3-carbon containing compound that is called as our propenyl-CoA. So the answer, not chain fatty acid produced on beta oxidation, it produces propenyl-CoA. Now I'll just say the other oxidation also. If the alpha chain, sorry, it contains branch chain fatty acid. What happened? We need something called as alpha oxidation. And one of the branch chain fatty acid is phytanic acid. So next type of oxidation, one is beta oxidation, other one is alpha oxidation. Then very long chain fatty acid, very long chain fatty acid undergo oxidation peroxisome. We call it as peroxisomal oxidation. Then one more. If the beta oxidation is not take place properly in the rate or some defect in that, then we have one more type of oxidation we call it as omega oxidation. Okay. So mainly 4 types: alpha, beta, omega, and peroxisomal. In the beta oxidation itself, for the odd chain fatty acid, the one of the product is propenyl-CoA. That propenyl-CoA can enter the TCA cycle. That's the point. Enter the TCA cycle. And one part of TCA cycle can be used for glucose synthesis. So only through that, through propenyl-CoA, through TCA cycle, enter for glucose synthesis. Only fatty acid that can be used as a source of glucose is odd chain fatty acid. Okay, please note that. Okay, normally this acetyl-CoA, one more point, next point, and the oxidation is over. Next point, normally this acetyl-CoA enter into TCA cycle. It will combine with oxaloacetate and form citrate. Last class we have studied about that. Citrate. It goes like that. Then citrate to isocitrate, acetate to oxaloacetate. alpha ketoglutarate, like that goes. And if this oxidation should come from the sugar, from the carbohydrate. If it is absent, acetyl-CoA cannot enter the TCA cycle. If this is absent or this is less, then this acetyl-CoA will enter into another pathway whereby produce a compound ketone body. So whenever body doesn't have the glucose, that means when we are on starvation, or whenever glucose is there, cannot be utilized, insulin deficiency, then oxacetate level, in both conditions, the level of oxaloacetate will be less, then acetyl-CoA cannot enter the TCA cycle. At that time, ketone body will produce ketosis. During prolonged starvation and uncontrolled diabetes mellitus, there will be ketosis. Please note that also. Okay. And name of ketone bodies. Name of ketone bodies, we'll study that also. Acetone, acetoacetate, acetoacetate, and beta hydroxybutyrate. About ketone body, some important questions. What are the questions? First thing, what's the use of ketone body? Ketone body is a source of energy. Ketone body, source of energy. Energy. Except liver and RBC. Liver and RBC. Please note, I'll repeat once again. Please note, I didn't say one point. Ketone bodies are synthesized only liver. Please, those who are listening, please mention that. Please write down somewhere. Ketone bodies are synthesized only liver. But it cannot be utilized by liver. Except liver and RBC, all other cells, including brain, all other cells utilize ketone body for energy. So 3 points. Where is synthesized? Liver. What's the use of it? Source of energy in absence of glucose. Third, who all cannot utilize it? Liver and RBC. So please note, liver synthesizes ketone body, but it cannot utilize ketone body. Liver synthesizes ketone body, but it cannot utilize ketone body. Why? Because one enzyme. That's also another question. Which enzyme? The enzyme name is thiophorase. Thiophorase. For the breakdown of ketone body, we need a enzyme called as thiophorase that is absent in liver. So the ketone body happens after it's synthesized, goes out to other cells, and other cells utilize ketone bodies instead of glucose for energy. It happens, and then so the ketosis mainly happen during 2 conditions: uncontrolled diabetes mellitus and prolonged starvation. Prolonged starvation. These are the 2 conditions during which there will be ketosis. And this also happens in severe vomiting in the first pregnancy, first trimester of the pregnancy, or we call it as hyperemesis. The first trimester of pregnancy, if they have a severe vomiting, at that time also ketosis may occur. So I just started with fatty acid, went to the ketone bodies. Next, about the cholesterol. Cholesterol, it has a ring. Please note that it has a ring called as cyclopentano perhydro phenanthrene ring. Cyclopentano perhydro phenanthrene ring. This is the Any steroids, any steroid contain this ring. Okay. What's the major role of cholesterol? In this one, the point is, see, is one of the component of cell membrane. What maintain the fluidity? So the point here, the answer is component of cell membrane. What are the other uses of cholesterol? Please note, there's no need to by heart. Please study now itself along with me. This is cholesterol. Write the word cholesterol. Divide this word into chole and sterol. Chole means bile. See how the word came? That's a sterol present in bile. That's how the word came. Now, what are the major compounds producing cholesterol? First one, from the word sterol, all steroid hormones. Steroid hormones are produced from cholesterol. Second, chole, bile acid, bile salt. Not bile pigment. Bile pigment is bilirubin. This is bile acid and bile salt. Third, we know on 7-dehydrocholesterol, when the light falls, what is produced? Come on. You can say by yourself, that's vitamin D. So, the three major compounds produced from cholesterols are 1, vitamin D, 2, steroid hormone, 3, chole means bile acid, bile salt. Can you name bile acid? Again, study that in that way. Bile, another word, chole, right? Cholic acid. Cholic acid. And one more is there, chenodeoxycholic acid. Chenodeoxycholic acid. And then, what are bile salts? These two, cholic acid and chenodeoxycholic acid, these two, what happened is, they are not soluble. To make it soluble, we attach that either with glycine or with a compound called taurine. So if we attach with glycine, we call it as glycocholic acid. Taurine, we call it as taurocolic acid. Same way, glycochenodeoxycholic acid, taurochenodioxycholic acid. These conjugate bile acid, salt. Salt of conjugated bile acid is called as bile salt. Salt of conjugated bile acid is called as bile salt. What's the use of it? It helps in the digestion and absorption of lipids. That means in the two processes. One, emulsification for digestion of fat. Emulsification. Another one, micelle formation. Micelle formation. In these two processes, bile salts are essential. So, emulsification, digestion process of fat, micelle formation for absorption of fat. So, we commonly say bile salts help in the digestion and absorption of lipids or absorption of fat. Okay, I just started with cholesterol. Cholesterol, the ring present in the cholesterol. Cholesterols, what are the major compounds produced from cholesterol? In that, bile salts function, I said. And then, cholesterol normal level, less than 200, simple to study. Milligram per deciliter. Okay, it's inside the body. That's the most important thing. One rate limiting enzyme in cholesterol synthesis, very important. HMG-CoA reductase. Why this enzyme is important? Why? Because this is a rate limiting enzyme, and whenever a patient is having hypercholesterolemia, we give a drug that inhibits HMG-CoA reductase. That's called as statin. That inhibits HMG-CoA reductase. Please note, HMG-CoA reductase is the rate limiting enzyme for the cholesterol synthesis. that is inhibited by a compound called statin. And then one more portion about the cholesterol. One more thing about cholesterol, how they are transported in the blood. As we know, from liver to tissues, from liver to tissue, it is by LDL, low density lipoprotein. But tissues to liver, it is HDL. Tissues to liver, it is HDL. So two things for the transport of cholesterol. One is LDL and other one is HDL. And we call HDL as good cholesterol. You know why? Because if the cholesterol is brought to liver, then only it can be removed from the body. Its accumulation can lead to one simple thing we always studied is atherosclerosis. The accumulation of cholesterol can lead to atherosclerosis. So HDL is bringing to the liver and helping its excretion. So HDL is called as good cholesterol. LDL is carrying the cholesterol towards the tissues, so it leads to accumulation of cholesterol. So it's called as bad cholesterol. The two things, good cholesterol, bad cholesterol. Transport by HDL, LDL. Hope you understood about the important things about cholesterols. Normal value also error. Statin, the word HMG case statin. The name bile acid, bile salts, steroid hormone, and vitamin D. Okay. Next question. The lipid transport, we need some functions of protein, some help from the protein. You know why? Lipids are insoluble in the aqueous phase. Blood is having aqueous medium. So it cannot be transported easily. For a transport, it will be combined with protein. They are called as lipoprotein. Combination of lipids and protein which help in the transport of lipids. And now here the question, what are the types of lipoprotein? Chylomicron, VLDL, LDL, HDL. These are the four major types of lipoprotein. Fifth also we say a combination of, just now I said combination of fatty acid plus albumin is another combination. That's also a lipid protein combination. Okay, in this one, which is having maximum lipid portion, which is having maximum protein, we just have a picture. See, chylomicron is the one containing 90% triglycerides. Always, all the lipoproteins are covered by phospholipid. So it will be having phospholipid. Some amount of protein will be there, upper lipoprotein. Some amount of cholesterol will be there. So triglyceride maximum in chylomicron. Cholesterol you check, around 50% of cholesterol, of LDL is cholesterol. So LDL is having the maximum cholesterol content out of lipoproteins. VLDL around 20% and HDL around 25%. And what is more HDL? HDL contains protein is more. Protein. Around 40% of protein is there in the HDL. So please note, chylomicron contains triglyceride more and cholesterol is more in LDL, protein is more in HDL. Now, what are the functions of each? Chylomicron transport what all food we have from the intestine towards liver. From intestine, then the tissues, the remaining to liver. So tissues and liver. All the lipids or dietary, so we say dietary lipids or exogenous lipids. Both words, please note. Exogenous or dietary lipids are transported by chylomicron from the intestine towards liver. VLDL carries our mainly triglyceride from liver to tissue. What all are stored in the liver? What are produced in the liver? It is transported by the VLDL. LDL and HDL transports cholesterol. Just now I said LDL transfer cholesterol towards tissue, HDL transfer cholesterol towards liver. Okay, hope you understood this part. So that's about the liver protein. Important thing we said, some small matters only we are supposed to study, and then study about the contents of upper proteins again, the 40% you're supposed to know it. Fine. Then again, the first question, fatty acid, the remaining part of that. In our body, we have saturated fatty acid, unsaturated. In that unsaturated fatty acid, we have both monounsaturated or polyunsaturated. Means polyunsaturated means it contains more the two or more double bonds. Two or more double bonds. Okay. So here, arachidonic acid, semi-essential, linoleic acid, essential fatty acid, PUFAS, palmitic acid is saturated fatty acid, and oleic acid. Oleic acid is this one, monounsaturated fatty acid. Palmitic acid and stearic acid are saturated fatty acid. Okay. True about the word prostaglandin, I said, from the essential fatty acid, you can synthesize a compound called as prostaglandin. Or in general, we use a word, even though the question in the paper was like that, to know that this word is also right. It's a common word. Icosanoids. Or icosanoids. Both ways you can pronounce. Means 20 carbon containing compound. First, no, this prostaglandin was isolated from the prostate gland. That's how the word prostaglandin came. Now we understood it's never is cell. It's there only minute quantity, but its action is so fast. Short half-life, but act, and what is short acting? That's the point. And it's some of them act with the help of cyclic AMP as the second messenger. So the answer is all are true. There are 20 carbon containing compound with cyclopentane ring. The parent fatty acid we call it as prostanoic acid with a cyclic ring structure. Most potent biologically active compound. One nanogram per ml can cause smooth muscle contraction. It's locally acting hormones. Okay. Prostaglandin synthesis, you should know this thing. So in this matter, all are true. And here, about prostaglandin, its action. We have some idea about that. First, I'll say about synthesis, because this is an important point. It is synthesized from the membrane phospholipid. When the phospholipids act, it produces a compound arachidonic acid of semi-essential. This one can undergo two types of pathway. One we call it as cyclooxygenase pathway or COX pathway. Other one, lipoxygenase pathway. And these compound, leukotrienes, lipoxin, prostaglandin, prostacyclin, thromboxane. They all together, 20 carbon containing compound, we use the word icosanoids. And these prostaglandin and leukotrienes have some role in infections, inflammatory conditions, pain, then swelling, inflammation. So, and some type of steroids, when we take at that time, that inhibit the phospholipase A2. So synthesis of the prostaglandin and leukotrienes will be released. It will be decreased. Thereby, they get a relief from the sensitivity reactions, hypersensitive reaction. Our in swelling or sneezing, it has a role in that. In pain, that's the main role. Okay, and COX is the one. That is the one which is inhibited by our NSAIDs, non-steroidal anti-inflammatory drugs, inhibit this enzyme, this COX, non-steroidal anti-inflammatory drugs. Inhibit the enzyme cyclooxygenase. Okay. Now about some functions. Generally, It can cause, some of them can cause smooth muscle relaxation. Some of them cause smooth muscle contraction. And for the contraction, you need calcium, muscle contraction. So for them, second messenger is our IP3, which one? Phosphatidylinositol, diacylglycerol, then calcium, thereby muscle contraction. Some helps in smooth muscle relaxation. That's through the cyclic AMP. Go through. Some helps in the relaxation by decreasing calcium level through the increase in cyclic AMP. But some helps in contraction or constriction. Again, our G protein coupled only. Their second messenger IP3 DAG, diacylglycerol. That comes from the compound. As I said earlier, phosphatidylate, phospholipid, phosphatidyl inositol. From this compound, IP3 and DAG will produce when the calcium level will be increased and causes a constriction. I'll say some examples now. PGE1, prostaglandin E1, vasodilation, muscle relaxation. But PGE2, vasoconstrictor, so they can induce a pain, labor pain, ulcer prevention, cervical ripening. Okay, then strong muscle contraction, PGF, prostaglandin F2, strong muscle contraction, again through this one only. Again through the calcium. That helps in the stopping the hemorrhage or postpartum hemorrhage. It can induce labor pain. So PGE2 and PGF2. There is the reproduction part. Then PGI2 vasodilation. In hypertension, we use that. Thromboxane helps in the clotting, vasoconstriction. Okay, and that is the target for our aspirin, thromboxane. And that's all. And the leukotrienes are bronchoconstrictions. Okay, so these are some functions, pharmacological functions that we studied there. Okay, when we study about the prostaglandin, or in general, icosanoids. Next question, another thing, another topic, lipotropic factors. See, in the liver, fat may accumulate. From the liver, the fat is transported. Fat means triglyceride. It is transported out by VLDL. VLDL to tissues. Suppose of storing a triglyceride adipose tissue, sometimes a lot of fat may get stored in the liver. We call it as fatty liver. Accumulation of fatty liver. So the point is, whenever there is an accumulation of fat liver, we call it fat liver, and the compound, the factors that help in the transport of fat from liver, they help with mobilization of fat from the liver. They are called as lipotropic factors. So fat liver may occur if the lipotropic factors are not sufficient. As I told earlier, transport of fat from the liver is done with the compound VLDL. Any lipoprotein, its outer layer contains phospholipid. So without phospholipid, VLDL cannot be synthesized. It cannot be so the fat cannot go out. Or the fat is going out with the help of VLDL only. So this any compound that helps in synthesis of VLDL can be called as lipotropic factor. In this one, our 2, phospholipid is a lipotropic factor. And more specifically, this is a general question. More specifically, the compound choline, betaine, methionine, inositol, folic acid, B12. Up to that, these all compound in some or other way help in phospholipid synthesis, thereby VLDL synthesis. So these all are lipotropic factor. See, choline, inositol straight away. Phosphatidylcholine, phosphatidylinositol, phospholipid synthesis. For the choline synthesis, using methionine, transfer the methylation reaction, we can synthesize choline from the ethanolamine. So, this methionine that what helps in the transmethylation reaction is called as lipotropic factor. Betaine is trimethylglycine. It's a methyl donor for transmethylation reaction. So, that is again a what factor? Synthesizing help in synthesis of phospholipid. So, lipotropic factor. Vitamin E and selenium are antioxidant because the accumulation of fat can lead to production of free radicals and the damage of cells. If they are there, that can prevent it. So they also in some or other way help as a lipotropic factor. So just I said about fatty liver, the compound that prevents fatty liver or compound that help in the transport of movement of lipids from liver, we call it as lipotropic factor. Some name examples. The common name, in general, we can use the word phospholipid because that's a part of VLDL. That helps in the transport of lipid from the liver to tissues. But more specifically, choline, betaine, inositol, methionine, folic acid, B12. These are the compounds that help in the phospholipid synthesis. Hope it's clear. Okay. Now, next, a small compound and some disorder. As I said, in compound lipids, if it is attached to carbohydrate, it's called as glycolipids. Glycolipid. This glycolipid, we call it as, see, one of the type of glycolipid is cerebroside. I'll just show the names of different glycolipids. Okay, the sugar is galactose, we call galactocerebrosides. So these are the words. In glycolipids, the first compound is a fatty acid plus alcohol. A long chain alcohol is sphingosine. Sphingosine plus fatty acid is called as ceramide. Ceramide plus one sugar, we call it as cerebroside, galactocerebroside, glucocerebroside. And that's a simplest form of glycolipid. And if there are more number of sugars, then we call it as globoside. If there's only one sugar, cerebroside, more than one sugar, then we could use the word oligosaccharide, then you use the word globoside. And what is ganglioside? Cerebroside attached to N-acetyl neuraminic acid, or simpler word is sialic acid. Cerebroside plus sialic acid is called as ganglioside. So I use the word ceramide, cerebroside, globoside, ganglioside. Now, usually any compounds in the body, after its function, after half-life, will get digested and removed. Sometimes, if the glycolipids are accumulated because of the absence of some enzyme, it's called as, in simpler name, we use the word, right here, sphingolipidosis. Sphingolipidosis means accumulation of sphingolipids. Sphingolipids. One of the examples for sphingolipidosis is Niemann-Pick's disease. And here what happened? Sphingomyelinase enzyme is absent. So phosphosphingosides will be accumulated. It's a phospholipid accumulated. And the enzyme name is sphingomyelinase. Deficiency of myelinase enzyme that help in the breakdown of sphingomyelin. That leads to a condition, Niemann-Pick disease. I'll just go through some more disease conditions. Gaucher's disease, glucose cerebroside is accumulating. Glucose cerebrosidase is the enzyme deficient. And there always in the cells, histopathology studies shows cell structure is crumbled tissue paper. That's a feature. Niemann-Pick disease, sphingomyelin deficiency. Study the name of the enzyme. Tay-Sachs disease, hexosaminidase. And next one is another unique one. Fabry's disease is only, that's only one which is X-linked. Okay. Enzyme alpha galactosidase. There number of, at least you study these 5. Gaucher's, Niemann, Tay-Sachs, Fabry's. Okay. Just study that. That's about the sphingolipidosis. And please note about the Fabry's is X-linked. Please note that. Okay. Now, the question is here. Because the following sphingolipidosis follows an X-linked RC pattern. Just now we said Fabry's disease. Fabry's disease. Fabry's disease. So that's all about some lipids. So lipid portions, please note I taught you about, I will just discuss you on fatty acid, essential fatty acid and saturated unsaturated fatty acids. Then comes phospholipid, 2 things from the chemistry part. Functions of phospholipid. There I use the word respiratory distress syndrome, deficiency of the enzyme, deficiency of the compound, lecithin. That too, dipalmitoyl lecithin or dipalmitoyl phosphatidylcholine. We always use LS ratio by 32nd month, 32nd week of gestation, pregnancy period. We check if we are down, we check the amniotic fluid to know about the lecithin sphingomyelin ratio. If it is more than or equal to 1.5, it is fetal lung is mature, fetal lung. Okay, then we use said about the word second messenger phosphatidylinositol, then phosphatidylserine, plasmalogen, phosphocephalin, sphingomyelin. Then we said about the oxidation of fatty acid, beta oxidation, alpha oxidation, omega oxidation, and peroxisome oxidations. And we were telling about oxidation of odd chain fatty acid. The product is propenyl CoA. If it is even chain, acetyl CoA. Acetyl CoA usually enters into this cycle with the help of oxaloacetate. In the absence of oxaloacetate or in the absence of glucose, oxaloacetate will be deficient. Then the acetyl CoA are diverted to, instead of going to DC cycle, it will be diverted to ketone body synthesis. Acetone, acetoacetic acid, beta hydroxy, butyric acid are the major ketone bodies. Then I said about cholesterol. Its structure, its normal level, common from cholesterol, transport of cholesterol. Then lipoprotein. 4 major type of lipoprotein, which is called good cholesterol, which is called bad cholesterol, Y. And what are the functions of chylomicron, VLDL, LDL, and HDL. Then we study about the word prostaglandin, its functions. So this is the lipoxygenase pathway. And cholesterol, one important point, HMG-CoA reductase. Okay. Then we said about this is over, cholesterol is over, prostaglandin is over, its function. Some act through smooth muscle contraction, some act through smooth muscle relaxation. Okay. PGF2, PGE2 for our pregnancy period to induce labor, to prevent the postpartum hemorrhage, for one more, our medical MTP, medical termination pregnancy. These two can help. Okay. Now we go to next topic. Next topic, minerals. Minerals straight away, one question, little bit twisting question. You know that calcium, normal level, 9 to 11. Calcium, normal level, 9 to 11. Nowadays, new books comes to the word 8.9 to 10.5. 8.5 to 10.5 milligram per deciliter. is the normal calcium level. When it is decreased, that leads to tetany. Okay. Now a question comes, in which type of asthmatic disorder tetany occurs, or simple word hypocalcemia occurs? That is a question. Now, there comes the point. Blood calcium level. Blood calcium level. As I said earlier, 9 to 11 or 8.5, 10.5 exists in three forms. One, ionized form. Other one, bound to protein, albumin. So this is around 50%. That means if it is 10 to 10, 11, if it is 10, average value 10, thing like that, out of that 5, it will be ionized form. Around 4 to 4.5 in protein, bound to protein. And then the complexes with citrate or phosphate, another 10%. Complex form. So it exists in three forms: ionized form, bound form, and complex form. Now, mainly made by three hormones, blood calcium level. One is our calcitonin. It is hypocalcemic hormone. Then we have PTH. It's hypercalcemic hormone. Then we have vitamin D. Okay. Other than these factors, another factor is any factor that helping in the binding to calcium, the protein. What happened in acidosis condition? There will be more H plus ions, more plus charge. This will attach to protein. Okay. So there will be protein will become positive charges. In acidosis, protein will be positive charges. Then calcium is also having protein charge. Then the binding cannot occur. Calcium goes out. So in acidosis, there will be increased calcium level. But in alkalosis, please know, in alkalosis, there will be some negative charges. So protein in the plasma protein will become having more negative charges. Calcium is having 2 plus charges, plus charge. So there will be more binding, strong binding, more calcium will bind to the protein. So because of which, in alkalosis condition, the level of calcium in the blood will be decreased. So that leads to hypocalcemia. And that leads to tetany. So in this here question, respiratory acidosis is the condition where the protein will be having negative charges. So the calcium, more blood calcium will bind to it. Because of which, it will attach to, calcium will be attaching to the protein, and then calcium will be less, and that leads to hypocalcemia. Serum calcium, deficiency 9 to 11, excess 3 forms, ionized form, protein bound form, complex form. Factors then regulate. Can be hormonal, non-hormonal. Factors are hormonal, calcitonin, PTH, and vitamin D. And non-hormonal factors, acidosis, alkalosis, serum phosphorus level, children, serum protein. When the serum protein decreases, of course, total calcium will be less. So alkalosis favors the binding of ionized calcium to protein. Decrease the level of ionized calcium. That leads to tetany. Hope you understood that. And that time, if you take the two signs, Trossius sign, hope you remember the word Trossius sign. Take the pressure, and if it kept for a long time, the cuff, if it kept for a long time, there will be, our toes become, again, tetany like problems will be there. Okay, so that's called as this one, trochanteric sign. Other sign, if we tap on the fifth cranial nerve, what happened at the facial here? Facial nerve. Sorry, facial nerve. So what will happen? That leads to twitching, or other word, our facial muscles, some paralysis like that we call it as Vostek or Chavostek sign. That's also the condition of hypocalcemia. Okay. So calcium just at the normal value and some condition that leads to hypocalcemia conditions. I was trying to say that. That's all about the calcium. Then about the iron. Most important part of the iron is about the iron absorption. You know why? Because the level of iron in the body is controlled, regulated at the state of absorption. Most of the other nutrients, absorption will be more and extra will be filtered out. But iron alone will be absorbed only if it is essential. If we have sufficient amount of iron in the body, iron will not be absorbed. That's why if you take an iron tablet, the next day morning, your faces will be black in color because extra will be filtered out. Okay. Now about absorption, some compounds in the daily food may will inhibit the absorption of calcium. Our phytate, tannin, phosphate, lead, these all compounds can decrease the absorption. But one compound that increases absorption is vitamin C. Because naturally, see this one. Naturally, the nature we have iron in the Fe2 plus or Fe3 plus state, but whenever it gets exposed to the oxygen, it becomes in the ferric state. This cannot be absorbed. Ferrous ions should convert to ferrous with the help of vitamin C and ferric reductase. Iron Fe3 plus convert to Fe2 plus. So for iron absorption, we need vitamin C. Now listen, we said divalent, Fe2 plus divalent. So we have a DMT1, divalent metal transporter. Through that, the iron is absorbed. In this cell, it may get stored as such, as ferritin. Otherwise, whenever it is needed, this iron in the Fe2 plus state, with the help of our another transporter, ferroportin, and the help of enzyme peroxidase. Ferroportin is the transporter. It enters the blood. There it binds with the again become ferric ions, bind with transferrin, goes to cell. There's a transferrin receptor, binds there, so that it will be stored in cells. Storage form is ferritin. So for the iron, storage form is ferritin, transport form is transferrin. Two transporter, DMT1 and ferroportin. This is the point. Whenever iron is sufficient, the DMT1 level and ferroportin level will be less. So iron will not be absorbed. That is a major point. So the absorption is controlled at the level of the DMT1 and ferroportin. Hope you understood that. Please said anything. Luminal phase, mucociliary phase, and the basal phase. So the iron about that is over. And a few more points about the iron. Iron, sometimes some defect in the gene that's involved iron absorption, we call it as HFE gene, that leads to the iron overload. Iron overload, we use the word hemochromatosis. Hemochromatosis. HFE gene disorder. Mutations can lead to condition hemochromatosis. There, please note, you're supposed to study a triad of symptoms. Commonly, we use the word bronze diabetes. Bronze diabetes. What is that all about? 3. Bronze discoloration, liver cirrhosis, diabetes mellitus. Altogether, use the word bronze diabetes. 3 features are there. bronze coloration, liver cirrhosis, and diabetes mellitus. Okay. Hemochromatosis, bronze diabetes. Study that. Then, whenever iron level is less, that leads to iron deficiency, anemia. There, serum iron will be decreased, ferritin will be decreased. Anybody increase? Very important. One compound called as TIBC. Total iron binding capacity on transferring. That will be increased. Daily iron will be transferring. If there is iron deficiency, the whole transfer is not saturated. More seeds are available. So how much seeds are available is called as TIBC. The remaining seeds on transfer is called as TIBC. And when the iron level is less, TIBC will be more. And we having anemia with a small size. So the MCV, mean corpuscular volume, will be decreased in iron deficiency anemia. Hope you know these things. Okay. Next topic. A patient suffered from hypogonadism, failure to thrive, loss of taste, and unable to maintain stability. This shows deficiency of which mineral? Zinc, chromium, copper, potassium. Here the answer is zinc. I will study about that. Before that, I will just say about chromium and go. One important feature you should remember with the chromium is one of the major nutrient that can increase the sensitivity to insulin action. Chromium, please note. There's a protein called as chromodulin. Chromium attached. When the 4 chromium attached to it, that can increase the sensitivity to insulin. Okay, I'll go to the functions of zinc. A lot of functions. You know the salivary protein gustin contain zinc. First point. Zinc is important for spermatogenesis, secretion of insulin in the beta cells, carbonic anhydrase activity of an enzyme that to maintain the renal regulation of pH. It's a component of another enzyme, alkaline phosphatase. That's important in the teeth and bone. Interstitial fluid transport. Zinc helping to regulate the absorption of fluid and electrolytes from the intestine, counteracting the fluid loss associated with diarrhea. Yeah, please note. So, in diarrhea conditions, zinc-containing compounds are given as a medicine because it can regulate the absorption of fluid electrolytes. Okay, so the fluid loss to some extent can be inhibited. Not only that, the mucosal layer integrity can be made with the zinc, support the regeneration maintenance of intestinal lining, which is often damaged during diarrhea. So, in diarrhea, in 2 ways, zinc helps. Immune function. Zinc is important in synthesis of RNA. It's a component of RNA polymerase. 1 point. So, in that way, it increases the immune function. What in the sense? Antibody productions. Cytokine production with monocytes, T lymphocytes, or the immune system is boosted up with the help of zinc. Clearance of pathogen. Zinc may help the body to clear the pathogens that cause diarrhea and contribute to faster recovery. Next thing, reduce inflammation. Zinc has some antioxidant property. It's a part of antioxidant enzyme. Thus reduce inflammation in the gut. Okay, so in that way also helps to contribute to diarrhea symptoms. Okay, so this much about the zinc property. So I hope you understood about the zinc now. Just now I said this answer for this one. Which mineral is known to potentiate the action of insulin and improve the glucose tolerance? Just now I said that chromium, by binding to the chromodulin. The primary role of chromium is to enhance the action of insulin. This happens to the specific process involving a low molecular weight substance called as chromodulin. It binds to that then the combination of it help in the activation. Okay, next question. Mengi's-Kingi hair syndrome is caused by the defect in the absorption of what? Here comes the answer is copper. When you think about the copper, two diseases you are supposed to know. One is Kingi's disease or Meng's disease. Meng's-Kingi's disease is called like that. Here, there's an absence of copper binding ATPase in the intestine. Please note, intestinal cell, a copper binding ATPase is absent. In intestine, please note. So, that's produced from a gene, ATP7A gene. If that is defect, if any mutations for the ATP7A gene, this enzyme will not produce, so it will not be absorbed. So in Meng's disease, there will be deficiency of copper. Okay, deficiency of copper. So copper-containing enzyme will not work. One of the enzymes is lysyl oxidase for the cross-linking of the collagen. That will not be working. So that leads to aneurysm, blood vessel ballooning. We call it aneurysm. So just not the thing, lysyl oxidase. That help in the cross-link in the elastin or collagen. Okay. So what about Meng's disease? Meng's disease, a copper binding ATPase absent in this intestine, so defect in the absorption. Now next one. Second disorder related to copper is Wilson disease. Again, copper binding ATPase, but in the liver cell. ATP7B, that was 7A, absorption A, study like that. ATP7A gene there, here the 7B gene. And this help in the copper binding ATPase in liver, help in its excretion through bile. Okay. So I use the word excretion or secretion of copper through bile. So if there is defect of ATP7B gene and defect of copper binding ATPase in the liver, what will happen? That leads to accumulation of copper. Please note, in Menkes disease, it was deficiency of copper. In Wilson disease, is accumulation. There comes a ring, case of a ring in the cornea, around the cornea. Okay, not these two disorders related to the copper. Okay, so and then other questions. Fluorosis, mainly is the function of fluoride, fluoroapatite layer, inhibit the dental decay. You know it because of the fluoroapatite crystals. Then about iodine is thyroid, help in the thyroid hormone synthesis. Okay, so here ends the major questions on minerals also. Hope you understood this part. Any type of any doubts, as I said earlier, you can put in the comment box so that it will be answered in the next class. Thank you.